Are you familiar with peritoneal dialysis?
Kind of.
Watch, let me
It,
explain this. Go ahead.
it's when they have it drains into their stomach, right?
Not the stomach, the abdominal cavity, but I think that's what you meant. Yeah.
Yeah.
Yeah. So if you think of like the patient, right? Here's a patient, and imagine this is the abdominal, the abdomen, right? And so let's say this patient's looking forward, okay? And so inside you have the cavity that encases all your intestines and stuff like that. And it kind of looks like this. On the surface, within that cavity, that little black line that I drew within the abdomen, you have a lot of blood vessels there. You have a lot of capillaries in there, all surrounding it. And those capillaries are what we're going to be using as a membrane. What I mean by membrane, do you know have you ever discussed the nephron? Do you know?
Yes.
The nephron is the structure of the urinary system. Let me draw it real quick because you do have to know that as well. It kind of looks like this,
Oh, yes.
right? And then so your entire body's blood supply makes its way to the nephron. You have a capillaries right here, but they're only arterial capillaries. And your blood goes in there and then it comes back out when after it dumps the waste that it no longer needs. And that waste moves this way and it goes to the tubules and eventually you pee it out, right? Well, the patient that has kidney failure, their nephrons are not working, right? So what we end up doing is we have to find another way to do some filtration to pull the waste out of the blood supply. So what we do with people that have peritoneal dialysis, we put a little catheter in here. And the catheter, in the picture, I don't have any of the intestines, no liver, nothing like that, right? But just pretend it's all in there. And on the surface of those intestines, you also have a bunch of capillaries. So you have a lot of capillaries in there. And if you recall, capillaries is where gas exchange occurs, but we also have the exchange of nutrition and waste because the capillaries are thinner than your regular blood vessels, than your bigger arteries and veins. So what we do is we have this catheter, and that's hooked up to a bag, and the bag has a solution, and that solution we call, excuse me, it's a little bag. It's got a bunch of fluid inside, and that fluid is known as dialysate. And the dialysate has properties that end up allowing as it goes inside this way, goes in that way, it fills up the abdominal cavity, right? It fills it up. We have all that dialysate in there. And so what it starts doing is it starts pulling all the waste from the blood vessels into that dialysate solution. So it pretty much does what the glomeruli or the nephron does, except we use our own membrane that we have in our abdomen. Does that make sense?
Yes.
And so the reason why we do that is because we have to get rid of all the waste. And after there's a couple of things you have to know, okay? When you're doing this peritoneal dialysis, you have the first thing you do is the installation process, or the installation, which is you're bringing all that fluid inside the abdomen. What you need to know about the installation is that the fluid has to be warm. The dialysate must be warm, or not cold at least. And you can never warm it up in a microwave and stuff like that. You usually use a heating pad that you place over the dialysate while you're waiting to set it up. Does that make sense?
Yes.
You could also use like a heat lamp, but it's usually some type of a heat pad that you put on top of the dialysate. So if, like, let's say this is your table and this is your dialysate solution bag, you're going to be putting the heating pad over like that. It's hooked up to the wall and all that, and it's radiating heat so it can warm it up. Does that make sense?
Yes.
And so that's the first thing you have to do, right? The installation process that takes about 20 minutes or so for the fluid to go inside. There may be some cramping initially when you have that dialysis catheter, the peritoneal dialysis catheter. There may be a little bit of leaking of fluid around the ostomy, but after about a week or two, it should go away. There should be no more leaking. And so you have to look out for things like cramping. That's why you want to do it slowly. That's why you want to do it within 20 minutes. And that's why you don't want it to be too cold, because if it's cold, it's going to cause abdominal cramping, which is going to cause discomfort for the patient. Any questions on that so far?
No.
The second phase is the dwell period, or the dwell time. The dwell time means how much time does that fluid have to stay inside the cavity in order for all the waste to be pulled out of the vessels into the dialysate solution. Now, it's supposed to be 8 hours, but understand that you can divide those 8 hours throughout the day. That's one of the advantages of peritoneal dialysis, that an ambulatory patient can do this, meaning someone like you and me that have jobs or that are not sick and we have to go places. Well, we can do that. We can do 2 hours in the morning, 2 hours at lunchtime, 2 hours after during dinner time, and 2 hours at nighttime. Or we can do 8 hours at nighttime while we're sleeping. Does that make sense?
Yes.
So the dwell time has to be a total of 8 hours. You can divide that up into what's most practical for the patient. Any questions so far?
No.
And then the last thing that we have to do is evacuate. Evacuate is when we remove the bag with the dialysate, because it's all inside now, right? So hold on. So we remove the dialysate solution. And now we have to use another bag to remove the dialysate solution. So we have this bag. And so what we're supposed to have is that fluid that was inside, start filling it up. Does that make sense? And we do it through gravity. Okay. And what you don't want to see is you don't want to see anything that's cloudy. If the solution is cloudy, this indicates infection. And because it's your peritoneum, the body, the abdominal cavity, peritonitis is a type of infection that you may develop that you don't want. And that means that the entire cavity of the peritoneum, what I'm circling right here, that membrane that I told you that we were using, that becomes inflamed. Now you have a problem. Your abdomen is going to get very hard. You're going to have a lot of pain, absent bowel sounds, and you can develop sepsis and die. Does that make sense?
Yeah.
So this is your whole peritoneal dialysis procedure. You should use gloves when handling. The biggest issue is peritonitis. So if the patient has an infection or something, they should wear a mask. Okay, they should wear a mask. And they should wear gloves, so there's no issues with cross-contamination, because that area right here may be contaminated. And you should also remember that whenever you have a tube going in and out of the body, your biggest concern is patency. You know what patency means?
Yes. Like the
Open. It's the tube has to stay open. That's what patency means. Make sense?
yes.
Cool. All right. Any questions before I move on? Mm-hmm.
How long after does it have to be drained? Does it have to be immediately, or is it just
After the 8 hours.
okay? So whenever after the 8 hours.
Yeah, at the dwell time. So like you'll have like a timer, and then after the dwell. So let's say that you're going to be doing it only for 2 hours during the morning. So you do it for 2 hours. Once those 2 hours are done, then you go ahead and drain it out. But you're supposed to do it after the whole 8 hours. Then after those 8 hours are done, that's when you start draining it. There's no like specific sign or symptom that you're going to have that lets you know that it's done. It's just the doctor knows, based on the solution of the dialysate, it takes about 8 hours for them to pull all the waste out of your body, and electrolytes. It corrects electrolyte balance also, by the way. and that's when you drain it, you evacuate. Make sense?
Yes.
All right, cool. Let me know when I can move on.
You can move on.
Okay. So go ahead. Oh, I'll just tell you this one after we get it.
One.
Final answer.
Yeah.
Remember that diarrhea is inside the intestines, not outside. This solution is outside, but because it's filling up the abdominal cavity, if we go back to my little illustration right here, you can imagine that if there's a lot of fluid inside, it's going to get in the way of the lungs being able to expand.
Oh.
So one of the most common side effects that we have to look out for is respiratory distress. Remember, it's only waste and electrolytes that are passed through that membrane, but glucose is not going to be affected. Albumin is definitely not going to be affected. Diarrhea is what happens when something's inside the intestines. Now, because you have a fluid around it, it can cause constipation. Okay. See, it says the nurse should, right here on the second part, it says the nurse should instruct the client to increase fiber intake to prevent constipation, which can reduce dialysate flow. So, make sense?
Yes.
So the issue is maybe potential constipation, but that's it.